having a great day. We are back. Tonight, we are going to talk about something that obviously came up in the clinic today, just like we do all the time. My name is Dr. Heather Moore, owner of Total Performance Physical Therapy. We are going to be discussing, can leg pain be caused by back problems? We get a lot of this. It's very common, and most people who have some sort of leg pain always come in and say, you know what, I don't know, but I think it could be coming from my back. You don't have to have back pain in order to have leg pain. You don't have to have leg pain in order to have back pain. So the answer is absolutely. It can be caused by the back. So, and this is where sometimes people can often be misdiagnosed, or it can be overlooked, because they'll come in and they'll say, oh, I have pain here. Could have pain in the groin, maybe even in the hip flexor area up here. Back in the hamstrings. The hamstrings are a very popular one. The hamstrings, if you're not familiar, in the back of your leg. Very popular area to have pain in that's actually coming from the back and have no back pain. So a lot of times we see failed treatment and people will go and they'll say, you know what, I'm having this hamstring pain. It'll be diagnosed as a hamstring pull, hamstring tear, and in fact, it's actually coming from your back. And when you just treat the hamstring, all you're going to do is solve the problem at the hamstring sometimes. Sometimes you don't even do that, but you don't ever fix the root of the problem, which is coming from the back. So why is this? So what happens is coming out of your back is you have a ton of nerves that run down. It's going to run down your back, down your glutes, down to your legs. They're going to come into the front. As these nerves get irritated, and they can get irritated in a number of ways. They can be irritated by a herniated disc, a bulging disc. Probably the most common way that you've heard of nerves being affected is that way. And unfortunately, a lot of us, if you get an MRI, will be diagnosed with a bulging disc or herniated disc, even though it may not be affecting your nerves. So be careful of that diagnosis. 80% of Americans have a bulging or herniated disc, and I'm using those terms interchangeably. It is not generally when you're diagnosed with that, they just use them interchangeably. So bulging or herniated, same thing. But 80% of Americans that have an MRI are diagnosed with a bulging disc, but they don't have any symptoms. I think I have 5 in my back. I have no lower back pain, whatever. But I've had 3 children. My discs are just now a little bit protruding, but I have no issues. I have no leg pain. Nothing's really happening with that. So be careful of just assuming it's a herniated disc because there's pain going down your legs and it's not going to be solved, and it's only going to be solved with surgery. It is not the case. Most of the time, pain going down the leg is solved by other means, and it doesn't really take any sort of surgery or injections or medication. So be aware of that. While herniated disc can cause leg pain, it's usually not the number one thing that can cause it. So what other ways can cause it is some sort of muscle imbalance, whether a muscle be weak, whether you're going to have knots. As these nerves go out and they go down your leg and in front of your leg and in back of your leg, you can wind up with them getting caught in muscles. So they go in and out of these muscles, and sometimes they're really little tiny tunnels that they're going in and out of. And as these muscles tighten, they're going to start to irritate that nerve. Well, as that nerve is irritated, and the nerve can be irritated all the way up here and cause numbness, pain into your leg, as that nerve is irritated, it will cause that pain in your hamstring, pain in the quad, pain in the adductors, pain in the front of the leg. So it's important to recognize that there are a couple of ways that leg pain can be caused. And there's a couple of ways that it can be resolved also. So one of the things that you want to do if you have leg pain and you think it might be coming from your back, you don't know if it could be coming from your back, is posture. And that is one of the biggest things that you can do to really kind of test and see almost. But again, I'm going to show you a test. Don't think just because this test doesn't produce any results for you that it's the end all be all. It is not. It's just a quick and simple test. But what you want to do is you want to put your hands on your back, and then you want to extend backwards and see if you have a change in leg pain with that. Again, you may have nothing. You may have no change. It may feel the exact same. Doesn't mean that the back is ruled out. But that's really a surefire way that if you go like this and you do this a couple times, 5 to 10 times, nice and easy, and you either find that it increases the pain in the leg or it decreases the pain in the leg, that's a telltale sign that you have some sort of leg pain that is coming from your back. Now, a lot of the other tests, we have to get our hands on you to be able to actually diagnose that, but it is extremely common to have that leg and back pain coming from, or that leg pain coming from the back. One of the things that you want to do right away, and it doesn't even matter if you have leg or back pain, is you want to check your posture. And one of the things that you want to do is you want to kind of check where your butt is. So a lot of people stand like this. They've got their knees fully extended, their butt sticking out, and they're standing back like this. So you're going to have this nice big curve in your low back. That's going to cause a lot of pain into your legs. So when you are standing, what you want to do is you're going to unlock your knees just slightly. You never want to stand with your legs completely straight. You actually are taking the muscles out of it and you're using more of your ligaments, making your ligaments more flexible, which is not something you want to do. So you want to unlock your knees a little bit. And then what you want to do is you want to tuck your pelvis under all the way and then stick your butt out as far as you can. Do that a couple times where you tuck your pelvis under and then you stick your butt out, and you tuck your pelvis under and you stick your butt out. Find the middle section, okay? Find halfway between where you're sticking it all the way out and then it's all the way under. Find that halfway point. That's where your pelvis should be. Most people, when they do this, are going to feel like they're walking around like this, okay? Because most people have their butt sticking out. It may not look like it, you may not feel it, but if you do that exercise where you stick your butt all the way out and then tuck it all the way under and then come halfway, you're going to find that you're going to feel like, oh my gosh, I'm squeezing my butt cheeks and I'm walking like this. No, it just means that you were sticking your butt out. That excess curve, that increased lumbar spine curve can cause a lot of issues down into your legs. And it can cause a lot of issues down into your legs without having any back pain. All right? You may never feel an ounce of back pain, and you may have pain going into your legs. So if that's the case, and again, this is something that even if you don't have that leg and back pain, you want to correct your posture, because then that's going to help you correct your neck, and that's going to help correct your shoulders, and all the way on up. So it's really important to pay attention to that piece. But absolutely, if you have leg pain, regardless if you have had back pain at all, you always want to make sure that you are checking the back. Somebody is checking the back. You're getting consulting from a medical professional to check that back, especially if it's in the hamstring, the adductors, right up in here, the groin, in order to rule out any sort of more severe issue. You are not going to get success with treatment if you do not address the higher up. You're just going to maybe get success right where they're spot treating it, but a lot of times it's not going to happen. A lot of times we get a lot of people in here who are frustrated because they went to a couple of visits and they never got it better because nobody looked up, what we call up the chain. So if your pain's down here, we got to start looking up the chain. You have to look at the back. It's imperative to do so. If you have leg pain, or someone you know has leg pain, and you think that it is coming from the back, or you want to see if it's coming from the back, all you have to do is call our office at 215-997-9898, and we'd be happy to give you a free consultation. Thanks, and have a good night.